Welcome to DEMOCREPUBLIX, where we cover the real news that matters to we the people. Minnesota authorities are using the coronavirus pandemic to launch a new program that collects and analyzes personal information of every patient hospitalized, regardless of whether they have been diagnosed with COVID-19. The information includes names, addresses, birth dates, symptoms, diagnosis, age, gender, race, ethnicity, city, zip code, and county. That's an infringement of privacy rights, the Citizens Council for Health Freedom asserted in a letter to State Health Commissioner Jan Malcolm. To the extent Minnesota hospitals have felt compelled by your letter to provide MDH with anything other than data that specifically relates to COVID-19, we believe you have abused your authority and infringed upon Minnesotans' health privacy rights, the letter states. Malcolm has ordered hospitals to provide the information on every hospital admission, with the goal of having 100% of Minnesota hospitals sending ADTs for the total population of patients receiving care in their facilities as soon as possible. ADT stands for admission, discharge, and transfer data. The state claims the patient name, address, and birth date won't be used in its analysis, but it's unclear how the data will be de-identified. MDH uses 3 laws, 2 state and 1 federal, to claim authority. But CCHF argued. No such laws authorize the broad health data collection demanded by MDH. Furthermore, no state law allows MDH to require a permanent electronic interchange system between hospitals and MDH contractors for the ongoing collection and reporting of all patient data. Twila Brace, president and co-founder of Citizens Council for Health Freedom, said the Commissioner of Health is trying to goad Minnesota hospitals into helping them build an illegal hospital-based surveillance system under cover of the COVID-19 crisis. But the Commissioner's letter itself shows its lack of authority. Despite claims of statutory power, there's no deadline, it uses the word strongly encourage and says its goal is 100% compliance, she said. However, MDH can use its government power to try to scare hospitals into compliance, exposing these hospitals to lawsuits for failure to follow Minnesota's strong patient consent requirement. Bray said the troubling aspect of the state effort is the claim that the federal HIPAA, Health Record Access rule supersedes state privacy laws, thus MDH says no patient consent for the mass transfer of data is required. The HIPAA law specifically authorizes stronger privacy-protecting state laws to supersede the federal HIPAA rule, said Brace. Since the Minnesota Health Records Act is the strongest patient privacy and consent law in the nation, MDH cannot dismiss the consent requirements in state law and has no authority to compel hospitals to turn these medical records over to the government without patient consent. MDH has year-long surveillance in mind, she warned. Once hospital medical record systems are electronically connected to the health department, MDH writes, the approach could be used in the future for other related activities. Other conditions MDH might want to expand to after COVID-19 are trends in drug overdoses, traumatic brain injury, spinal cord injury, vaping-related lung injury, or other current or emerging public health threats, she said. Bray said Malcolm must rescind the program and notify all hospitals that received her letter. If she refuses, Governor Walz and the Minnesota State Legislature should order Commissioner Malcolm to rescind the letter before this unlawful all-patient hospital surveillance system is set up in perpetuity. Brace writes in her letter to Malcolm. We find it egregious that MDH has used a legitimate crisis and legitimate public and hospital fear caused by that crisis as an opportunity to illegitimately invade hospital records and individuals' medical data and to set up a system to do it into the future. One law cited by the state agency actually addresses conducting studies and investigations and analyzing vital data. Brace's letter contends it in no way empowers MDH to compel hospitals to provide MDH with access to all patient data and certainly does not empower MDH to use the fog of fear and panic caused by COVID-19 to grab powers not granted. Especially alarming was the state agency's plans to use its access to data in the future. This regulatory demand to create a long-term direct link between the state government and private hospitals for the near real-time transfer of private patient data is an overreach and a violation of patient privacy and consent rights, the letter said. Let us know what you think. Leave your comments down below. Like, share and subscribe. And check out DEMOCREPUBLIX.com for the latest in news. Until next time.
We live in a real nightmare. We live in a real nightmare.